clear vision in Tameside, where children and families are at the heart of everything we do. And as part of our investment in early help, Tameside invested across the partnership in developing the Early Help Panel.
In Tameside, we understand the impact that diversity can have on children and families, and the Early Help Panels, which started in 2018, consist of a range of early help services coming together in a meeting to identify the best course of action and the support to be given. As part of the Tameside's early help strategy, Smarter, Stronger, Sooner, Safer, we work in partnership with children, families and professionals to ensure that we offer the right support at the earliest opportunity.
Setting up the Early Help Panel and establishing it has been a really rewarding journey. All support services that are involved share the same common goals and values, which is to help and support our children and families.
The panel's role is to review a set agenda of family cases each week, referred in by a range of services. The panel's discussion is based on a strength-based approach and shares information that can benefit the allocation of families to the service most appropriate in supporting the family with their needs.
The Early Help Panel embeds the Signs of Safety model, and this is Tameside's practice framework. Signs of Safety is a relationship-based approach and focuses on professionals working together with families to build upon the areas of strengths and recognise worries and needs together with the family and what needs to happen next.
The Early Help Panel ensures that children and families are able to receive a robust, effective and timely package of support.
The panel consisted really of our key partners and agencies, so health, education, our voluntary sector Action Together and local authority services. And this enabled us to have a real safe sharing of information.
As a parent of two boys, I was referred to the Early Help Panel. I spoke to the Early Help Access Point who explained the process to me very clearly. They asked me some questions about my circumstances, when my case would be heard at panel and if I consented to this, which of course I did. We wanted help.
I'm an early help assessment advisor. I attend the multi-agency panels weekly. My role is to bring information obtained from educational settings in relation to the children that attend those settings and share that information at the panel. The panel then will make a decision on the best agency to support this family, and from that I will then feed this information back to the educational setting.
They also spoke to the boys' school to start an early help assessment and then referred my case to the panel. I was struggling with parenting, the boys' behaviour, school attendance, and this was impacting on my mental health, which was a worry as well.
As a support service, we attend the Early Help Panel. Once the service has been identified, the worker will focus on the family's strengths and also areas of need to develop a plan.
So attending the Early Help Panel can be really useful to kind of identify as soon as possible if a young person may need extra support with their mental health and well-being. So it's an opportunity for me to kind of explore what's already working well for a young person, what kind of support they already have, and if we need to think about any other support that can be offered or that they can access. Also, it gives me an opportunity to speak to other professionals who may be already working with that young person or may be due to start work with that young person, so that we can have a think about can any consultations be booked with myself to further guide their work to also consider mental health and well-being. Overall, attending the Early Help Panel meeting is really positive, just so that we get support for young people's mental health and well-being as soon as possible.
The Early Help Panel utilises the Tameside's thresholds document, and this helps us to assess the needs of that family and ensure that we're putting the right person at the right level in place to support the family.
We get a wider knowledge around the table. Other professionals are learning more about children with additional needs and how they can support where historically they wouldn't have even looked at the cases, they'd have just wanted ISCON to be involved. Everyone has a part to play, and by being at the panel, everybody does play their part.
Multi-agency working allows us to build really good relationships with other professionals, have a better understanding of how different services work, and to share information to support our children, young people and families across the borough.
Representing health, I will share information from hospital and community settings, and also use my expertise as a registered nurse to inform the panel of what I feel that the family need.
I am the link to the voluntary community sector when attending the Early Help panel. I am part of the discussions that take place. I offer advice and support about what is available in the local areas and a takeaway action points allocated by the Early Help panel.
Tameside Education Welfare Service work closely with the Early Help panel to improve outcomes for families who need support at an early help level.
Helping to build positive family relationships can assist in empowering families to sustain change and prevent escalation into statutory services.
So the Early Help panel care about what they do, and together as the partnership we strive to be the best and bring out the best in others. This enables us to empower families to sustain a positive and meaningful change.
The Early Help panel identifies the right support so that families can build on their strengths and work through any worries that they or their children may have. It's important to point out that we will only do this where we have consent from the family.
If you are struggling and need any support, I would recommend asking for early help, as we wouldn't be where we are today if we hadn't received the help so quickly, which has made such a difference. We all need help sometimes, and that's okay, and these are the professionals who are there to help you and your family get back on track again.
One of our main aims is to work with our families in Tameside and not against them.
It just gives them confidence, all because they've had some early intervention. I see it working, I see it from the start, I see the middle bit, plan, do, review at the end of it, and it works. So all I can say is thank goodness for early intervention and early help and all agencies working together.
I think really the strong and robust partnership approach is the strength of the panel, and the enablement to share that information ensures that we really are committed to achieving stability and security for families and support them at the earliest possible